This video is about trigger point therapy. Oftentimes people will complain of chronic pain. They may have had it for years. They could have odd symptoms. The first place I like to look is to the most simple. I'm a firm believer that we start with the simple before we move to the complex. Oftentimes many of us, when we have pain, will run to an MD. About the only thing they can do is either tell you that they don't know the source of it, they can give you muscle relaxers, they can do things. But with trigger point therapy, those approaches actually aren't very effective. The reason being is that what happens within your muscles is that muscles are made up of fibers. If you get a little knot in that fiber, it's much like embroidery thread. The more you pull on it, the more you poke at it, the tighter that can get. I like the technique that I've discovered. I actually bought several books on a topic called orthobionomy. Orthobionomy actually comes from the field of massage, and what they realized is that if I could work in cooperation with the body, not in domination of it, many people like to massage the heck out of those and bruise you. Instead, if I can go in gently with the body, work in cooperation with it, the body will actually release that trigger point and you get relief of symptoms. So it's a really easy technique to use at home. I have a couple of reference books I'd like to show you. If you check our ttv.org website, we have links to go out and purchase these books. But these are great ones. You can also find them in your local bookstore. This is the Trigger Point Therapy workbook. It has very good points. I have not yet found one book that shows all of the points. So I've also gone out and purchased this one, another nice reference, Trigger Point Therapy for Myofascial Pain, because we often get those in the myofascial tissue. So great little resource books. So if someone has a pain, these books will actually show you where those areas are and what may be the associated trigger point. You can also pick up apps for your phone or for your iPad. Now, here's the interesting thing with trigger point therapy. Ellie has presented today with some interesting symptoms. So why don't you tell us a little bit about what you're experiencing?
It's like the inside of my ear itches and
Constantly?
it hurts.
And it hurts? Yeah. Any other symptoms within your face that you notice?
I kind of like have where my eye doesn't feel like it wants to open, like it's kind of sagging a little bit.
Tension? Okay.
Yeah.
So here's what's interesting. If you were to look into these books, what you'll find, and I'm going to have you turn your head, your masseter muscle runs right through here. So she complained about her ear, but I'm not going to go in and try to fix the ear, because what happens with trigger points is they create referred pain patterns or referred symptomology. So with the masseter muscle, you can get a number of trigger points here. Oftentimes these can become enraged after dental work. And people wonder why they have problems. They go back to their dentist, they have tooth pain. So symptoms with trigger points in the masseter muscle can include teeth that are sensitive to temperature, like heat and cold.
Yes, I have that.
You can get itchiness that you just can't seem to get to in the ear.
Yes.
Maybe a dull roaring sound in the ear.
Oh, I have that.
Okay. The other thing that you can get is that you can get pain patterns above the brow, into the eye, and down into the jaw. So it's that sense of tension. So what we're going to do is we're going to check this theory out. So what I'm going to do is I'm simply going to come along here until I can find whether...
That one.
Okay, so did you even know that was sore prior to this?
I don't think I did.
Okay, so because we have Ellie sitting in a chair rather than lying on a table where I could apply, now again, I'm not going to apply pressure. I'm not going to go in there and dig on this because I would actually cause bruising in this area and some inflammation, not beneficial. Instead, I'm going to ask Carol to come in and just support Ellie. And the reason she's doing this is that I want Ellie to be able to relax, not have to use any other muscles to support herself, because I need to come to this point. And let's go find that again. So tell me when I've hit that sore spot.
There it is.
Right there. Mm-hmm. Now what I need to do, the masseter muscle runs with its fibers in this direction. So what I want to do is I want to relax the tension on that muscle. So here's the point that was sore, and I'm going to push in on that, and I am going to compress the muscle in the direction of its flow, and then I'm going to push, and is the soreness gone?
Mm-hmm.
Okay. So now I don't have to put any pressure on. All I'm doing is I'm holding my finger lightly on the spot, and this is a way energetically to let her body know to pay attention right here. And because I've released the tension, the body can pay attention and go, ah, yes. Now here's what's interesting. When you do this at home and you find a trigger point, you're going to notice that it's as if you hit a grain or a small pebble underneath the skin. You won't feel a pulse there. And as I lightly hold, I can feel a couple of things. I can actually feel a slight temperature change. I can feel the muscles soften as the body works in cooperation and releases. And then I'm going to slowly let go when that happens. You can feel a pulse come up. And now I can check again. Is the soreness gone?
Yeah.
It is. And so now let's just check any change.
My whole right side of my face feels like it's all been to a massage. It's all loose and happy.
Yeah. So let's check and see if we can find a couple others.
Oh, there was one.
One right here.
Yep.
Okay, so Carol, if you'll support her again. So again, I'm going to have her just be able to relax. I'm going to compress the muscle. I'm going to hold. Any soreness now? Okay, so now I can back off. I'm going to gently hold the spot. You only need to hold this spot for about 30 to 60 seconds. Doesn't take long. The body wants to heal. It just sometimes needs a little support, a little bit of attention. I can feel the muscle shift. It's very subtle when you do this. It's the difference between, I guess the analogy I have is if you have a piece of fruit and it's not overly ripe, it can have a firmness. And when you find that soft spot where you get compression, it's like that difference between the firmness of an orange and then finding a soft spot. The muscle actually loosens enough to feel like that soft spot on a piece of fruit. And now I can push.
Yeah.
And now what do you notice?
That felt good.
That felt good.
This is all opening up. That's neat.
And we didn't check this earlier, but can you give us a wide mouth? How far can you open your mouth?
This side not so much, but this one's opening.
Yeah, so we can do this on the other side as well. Prior to doing that, I did do a quick little check on her, and she could get her mouth about like this. And so she's opening her mouth a little bit wider as this loosens. So we can continue to do work, but any notice with your ear?
Yeah, it's like it doesn't itch, but it feels like there's circulation in there now. Like it's all happy and warm.
Great. So I'm going to work with Ellie next off camera, and I will go ahead and check for additional points in here, and we'll follow up with you in a couple minutes and see what. So do it one more time for the camera and show us how wide you can get your mouth. So that's as wide as she can open. You're feeling tension here?
Mm-hmm.
Okay. And we're going to pause for a moment while I finish working on her, and we'll be back with a final to see how this works when I work both sides of her face. All right, as a follow-up now, the work that I did while we were off camera is I went ahead and released some additional points that were here in the front of the masseter muscle, right along the edge. And then we came over here because she noticed this was all relaxed, but felt the tension here. And came in and found a pretty hot little trigger point right here. We found another one here and one right up in here. Weren't causing her symptoms, but definitely gave her an imbalance to her jaw. So as you may recall, we had her open her mouth. So let's do that. If you'd look at the camera and give a wide open of your mouth. Probably twice as wide as she was able to do before.
Cool.
Now here's the fun thing. So you really don't have much in the way of bags, but one of the things that trigger points in the masseter muscle can do as well as the pain and the itch in the ears is that actually can be a contributing factor to bags under the eyes. So it's a great area. Go look for your own. This is work you can do on yourself. It's a little more difficult, but possible, because if you notice, I was just compressing the muscle and holding the point. But easy work to do. It's when you get into the lower back and areas that it's helpful to have a friend or spouse help you out with that. So now, just a general take on what you notice about how it feels.
It really, especially on the right side, loosened all of this up. It just feels more flexible.
Mm-hmm.
Yeah.
Another side effect of trigger points are sinus drainage. So when you have that sinus drainage and you take sinus medication, doesn't seem to clear it. Oftentimes that's your masseters. Do you notice anything in your sinuses as far as breathability? Take a deep breath in.
I can breathe easier. I don't feel any drainage, but I don't usually. I don't have a lot of sinus problems.
That's good.
But it's easier to get air in. Oh, that's interesting.
Interesting. Thanks. Go work on your masseters.